Afternoon and welcome. Welcome to our Lunch and Learn, which is showcasing the impact of creative health for children and young people. What we're doing today is we're recording predominantly this Lunch and Learn session for people who are unable to attend, but then we can add it as a resource to our website and share people that have registered for the session today. I'm delighted to be here today, and what we're going to do is to share two examples of creative health work in primary schools. We can go on a couple of slides if you like, Carol. Thank you. That's it. Thank you. I'm delighted to be here today to help share two fabulous examples of creative health in primary schools and how they demonstrate impact. And also, we do have the opportunity for people that do join us to ask questions directly. And then also from seeing the examples, you might be able to apply relevant ideas and suggestions and methods into your local work. Mel is also going to share details of our Chris Drinkwater Creative Health Awards, which is open to primary schools and cultural organisations to share their work and the benefits it has had in children and young people in our region. We hope that it will inspire new applications for this, and they close in early March, and also give you guidance on impact, because that's an area that some of the applications have previously struggled with, and it will make sure that your applications apply the relevant information in this area. So hopefully this is going to be really useful for that. And we've got an expert panel, which gives you further opportunity to ask questions more specifically about the application, but also more generally about creative health from the different parts of the system. Okay. But first, a word about the network. My name's Heather Corlett, and I've got the privilege of leading the Child Health and Wellbeing Network for the North East and North Cumbria. And our purpose, as you will see, because Carol will take us along to that slide, is to enable people, young people, to thrive by coming together in partnership across our organisational boundaries. And that's key. And our work today is a great example of that. We're mapping education with health and with the culture sector. So the following slides are going to be shared, but I'm just going to pause on our visions and priorities. So can we go to our priority wheel? That's it, the next one, thank you. So you've got that shared vision that I just mentioned, and also in the middle there, you've got our priority wheel, and it just highlights all the different areas of the network's priorities. And in there, you'll see children and young people at the centre, and bottom right there in the green, the important areas, arts and creativity. To the network, take a real system view, and we look at all the cross-cutting themes and enablers that enable young people to thrive. And then if we just click through the remaining slides, and we'll get to our quote. That's just our geography, facts of life. There's great resources in these slides that you can look at, the manifesto from our young people. And then here, Al Ainsley Green was the first children's commissioner, and this is a quote from his recent book. And it really helps, it sort of galvanizes us in our message for young people. And it's incumbent on us to ensure that we do make sure that children matter. And just topically for this Lunch and Learn, that bottom link there and the quote is from a recent piece of research, and I'll put the link in the chat. And it was published in The Guardian, I think, earlier this week. And it states there a study of over 3,000 young people aged between 18 and 28 found that taking part in organised artistic, musical and theatrical activities made them feel happier and gave their lives more meaning and value as a result. And I think that gives real weight, because for those young people to get those benefits in young adulthood, we need to ensure that they have access to the arts at a younger age. And I think that's one of the items that one of our panel members, Chris Drinkwater, himself will be sharing the importance of that and why we focus into primary schools. So the slides will be shared at the end of the event, and the recording will be added to the website. Please do use the chat facilities and ask questions. And without further ado, I'm delighted to hand over to Martin Wilson, and we will hear it's flipped around from the agenda order. So Martin is going first to ensure that the fabulous Charlotte from Grangetown Primary School could squeeze this in between her other commitments. So delighted that both Martin Wilson and Charlotte Mott are with us today, so we can hear about our first example of creative health in primary schools and the impact and how we've demonstrated that. Thank you.
Thank you, Heather, and welcome everybody. I'm going to give a very quick guide through STAR and how we've approached understanding the impact and the outcomes associated with the project. And Charlotte also, towards the latter part of the presentation, will talk a little bit from the school's perspective, as Grangetown Primary were an active school within the first 2 years of STAR. If you just go to the next slide, please, Carol. So just a quick overview of what STAR is. STAR is an arts primarily dance engagement project that started to explore physical and mental well-being through dance and creativity. So over the course of 3 years, we've worked in the Tees Valley and in Newcastle, and we started to explore how can arts support young people and pupils to develop self-awareness, explore identity, and acquire social and emotional learning skills. It was initiated by the network itself, so it's an initiated program. And as I said, over 3 years, we engaged around about 1,500 pupils, and in total worked with 10 schools. So we go to the next slide. There's a little at the top there, you can see a short definition of what STAR is. And we looked at the improving the health and well-being. We particularly targeted deprived areas initially in the South Tees and then moving to Newcastle. And it was about exploring, when you offer greater access to the arts, in particular dance, what health inequalities can you then start to address through that work? And what we're sharing today really is not necessarily, we will move a little bit onto impact, but the questions we asked ourselves at the outset, the kind of ingredients of how we might look at impact and outcomes. So we started to sit as a range of partners, and those partners involved universities, schools themselves, teachers, and the artists and the arts organizations, as well as the network, as well as Children North East, who are looking at family engagement work. What do we mean, and how shall we determine health and well-being? It's a very broad church, and health inequalities it's quite an endless list of areas you can explore. So we tried to narrow down where might we look to focus our attention and how might we do that. And therefore, what data could we gather that would help us understand those outcomes and impacts, given that we were working with families, we were working with schools, and we were working with artists and universities. So what was available to us? And that leads to our third question, which was, therefore, what capacity do we have? Because we could set ourselves very ambitious and aspirational targets, but actually, do we have the capacity to do that work? And what assets do we have? And by that, I mean the people who could be involved and their areas of expertise and their areas of experience in actually capturing outcomes evaluation. That allowed us to define our key groups and how they might best engage in evaluation. And in a minute, the next slide, we'll talk a bit about how. But the key groups we had identified were that we had pupils who can engage, who actually take part in the activity. We had teachers who were wrapped around the activity and a massive partner in the work. We had practitioners, both arts practitioners who were delivering dance and practitioners who were working with the families. And we also had the families themselves who were supporting the children and young people. So we knew that these were the key groups we could think about, and we could map them into our evaluation to look at the impact and outcomes. And then the final thing, which is just a really key question for us, was to kind of self-check to what extent are we reflecting upon the model of engagement, and to what extent will we actually look at the outcomes and impacts. And I suppose that was about us thinking about just being careful not to make sure we were constantly thinking about, well, is STAR an effective model, as opposed to actually what does the impact comes from the STAR model. So we weren't getting too caught up in the process and much more looking about the outcomes that arrive. If we go to the next slide, please, Carol. So when we looked at the 4 key groups, we thought about how might we engage them. So we knew that with pupils, we could pull them into focus groups in school time. We knew that we could do surveys before and after, and depending upon whether they were key stage 1 or 2, we have to model those surveys and think about how they interacted with those. We knew that there was constant observation by the artists, by the teachers and families, and the observation and that qualitative gathering of information was really important. That was pure data we could look at and rely on. The teachers were happy to engage in surveys, and those surveys could be before, during, and after all activities. They were also happy to engage in focused conversations, and that was a through line throughout. And they were happy to kind of keep logs. When they saw something they wanted to capture, we encouraged them to write it down and keep it there in the moment and not try to reflect and retrospectively remember something that happened a year ago. The artists were also encouraged to keep diaries throughout after every session. They made notes about what they'd seen, and they were really encouraged to make observations because, as a particular example, in a dance project, a young person starting a session at the back of the class and over a period of time moving closer to the front of the class speaks volumes. There's learning in that about they're getting more engaged and they're more excited and anticipated, but that can go really unnoticed actually. So it didn't matter how small the detail the artist felt it was important to capture these things down. And with the families as well who were supporting the young children and connected through Children North East, we asked some surveys. Those weren't necessarily massively engaging because people were struggling to access those. They were more engaged in focused conversations, inviting them into school, offering them a cup of tea, offering them a sandwich, and actually sitting around a table and talking about the process. So we managed to map out the groups we wanted to engage with. And if you go to the next slide, please, Carol, we start to look at how some of these data, how this kind of fed through. So here's an example, particularly from year one, of using the diaries, using the logbooks, and using the focused conversations, the themes we were able to identify. And I won't talk through all these, but what it really notes for us is that everybody's perspective was really vital and important in giving us a really round, broad church of input and understanding about what we're doing. How the children were talking about the engagement and experience, is different to the teacher's perspective and the parents and the artists, but it all connected together to bring through some core themes. So there's an example of the qualitative things we were gathering. If you go to the next slide, here's an example of using surveys with pupils. So they would be a simple kind of survey to slide a scale from a not so happy face to a really happy face and finding a metric in there. And these actual numbers have crossed the whole 3 years of STAR. So it's telling us which bits of the model were working and where the impact was coming from and how that was. And we were really keen that things like felt well, felt confident, felt fit were coming through. Finding the language to work with the pupils was really important. So all these surveys were designed with young people to talk about the words that they would describe and how they would come about. We try not to impose language upon that. But then if you go to the next slide, then we get down to the actual, when we talk to teachers, the kind of surveys and the questions became a little bit more in depth and longer form. And we asked for things like, did they notice changes in behavior? Did they feel that the model was working in terms of self-confidence, resilience? So we were able to go a bit deeper and the scale was increased so we could have more variation across that. And as I noted in the earlier slide, this is about capacity and assets. So we didn't have a lot of resource. We did in STAR 1, we had university colleagues, but in STAR 2 and 3, the second and third years, we kind of had to find a self-guided way to evaluate. So we picked up what we'd learned from university and started to find something that would work for us and was manageable, but crucially enabled to have a through line from STAR 1 to STAR 3. So we were able to keep the same questions and the same threads running through so we could get a global perspective and it wasn't we weren't chopping and changing as we were looking at each year. If you go to the next slide, I think that's going to be our final way. Yeah, so we're not going to play the film quite yet, but this is a really good example of there's power in conversations around young people in terms of documenting video and photography. Dance as an art form is a live art form that needs to be captured and seen. So we did a lot of time filming dance and looking at what we did, but we also did a lot of time just offering young people a chance to talk to a camera and say whatever they wanted to say in an unstructured form. But before we show that film, which is our kind of final 1 minute thing, Charlotte, can I invite you to kind of talk for 2 minutes about how the school engaged with the kind of evaluation of outcomes and impact and how that worked from your perspective as well, please?
Yeah, of course, Martin. So hi, I'm Charlotte Mott. I'm the head teacher at Grange Primary School. We were really lucky to be involved with STAR right from the start, and had lots of conversations before the artists came into school to work with our children. So we were able to help Martin and the team kind of map out what it would look like in the first instance. And I think really from a school's perspective, just adding to some of the things that Martin has talked about, we were able to get more data, not just on the specific things relating to STAR. So we were able to speak to staff about their CPD and being involved in the project and having an artist working alongside them was something for my staff that was amazing, and an opportunity that in school we very rarely get. So we were able to talk to staff about the impact that that artist has had on their own teaching development, and how then in school we were able to offer some consistency, especially around dance and what that looked like within school. And I think that had a more lasting impact on our children once STAR had finished for us. I think, just echoing what Martin said, for us as a school, I felt we got a wealth of information from those conversations with parents. Actually speaking to parents and having them in a room was where I feel we got the real benefit, and things came out like challenging gender stereotypes. Through those conversations, we found out about the change of mindset around movement and dance. Some of my parents they didn't even know what ballet was like. When we took them to the theatre, they thought it was a pantomime. They'd made the assumption that ballet was a pantomime, and actually through this process, the conversations now that they have with their children, they know more about the arts. So as a community, I feel like it's had a big impact too. I think another thing that we really sort of could look at as a school was those lifelong skills that they learned through STAR, and that character development. And I think further conversations with our children, we found out a lot about aspirations and that cultural capital side of things. So yeah, we were just really privileged to be involved with STAR from the start.
Thank you, Charlotte. That's really great, and it reminds me of one key point, which was very keen framing from the network, is that actually, if we think about sustaining impacts on health inequality as young people, you need to take the family on that journey with you, because they are a huge influence and a huge informative power in those young people's lives and opportunity. So those conversations with the families were the hardest to get, but they were the most revealing and sustaining about how we might take this forwards, because we can gather those impacts and evaluations, and we can use that for future funding. But actually, it's also it's the families where it really sticks and sustains. We're really keen for that to happen. So often the best way to reflect, and this is our final part, on the impact of arts creativity, particularly in our project and health quality young people, is to hear from the young people themselves. So as I said, this was free-form video logs, so they were just invited to talk to our videographer. There were no questions. They were just asked, what would you like to say about the STAR project? And so whatever came out, came out. So Carol, could you play our little 1-minute clip of the conversations with the young people, please?
In dancing, it's a really fun way to get all your expressions out and help your mental health.
Because they make me nice and calm.
Because it's getting you fit, like when you're dancing and stuff.
And to be able to like make up stories through body language and without speaking.
It makes me feel like I'm in a place of happiness.
It's just very calming and relaxing when we do all of the like exercises.
With writing and things, it's just you're very stressed and tense. But with dancing, you can be creative and you can do what you think is right.
Get to show off my creativity and my skills of dancing.
It's very good because you're like sad. It get you more happier.
Because before I go and dance, I've got super excited.
And it gets all your sadness out of your body and angriness out of your body.
With dance, you get a break from reality and you get to relax and just let yourself be yourself. You're allowed to be yourself.
It would be very hard to put that slide at the front and try to follow it. So that's why we always leave it to last. But I think what they say captures everything about the project with STAR. And I guess it's our job with Charlotte to make sure we articulate that and amplify that to get more funding so more young people can kind of have those experiences as well. Thank you, Heather.
Fabulous. Thank you ever so much, Martin and Charlotte. And as you say, I mean, I just jotted 2 quotes. I always love that video. I never tire of seeing it. But if something can get all the sadness out your body and be yourself, you know, wow, that is just amazing. And I love the variety of approaches that you've used within STAR. And indeed, we've had the very formal research one, and then how you've adapted that. So that's what I love that you've demonstrated. And Charlotte highlighting the importance of a CPD opportunity as well, and the impact that might have on the school and retention and development of those teachers. And then importantly at the end there, the introduction of arts for the community. And I'm sure Chris would be delighted to hear that, because that was one of the reasons why primary schools were chosen, because in a lot of primary schools the children are still being brought by the parents to the school, and there's a more of an opportunity to influence and get that and you know the value of speaking with the parents as well. So if anyone has any questions, we can take one before we go to Bigfoot. Chris, I didn't know if you wanted to come in on that point.
Yeah, quick comment in terms of why primary schools. I mean, two reasons. One, much easier to engage with parents in primary schools than it is in secondary schools. Part of growing up is becoming an adult, distancing yourself from your parents and your family. So working with parents is a key part of that. And I think the other thing is sort of a lot of emphasis at the moment on STEM. And I'm not saying STEM isn't important, but we need the arts in there, because the arts is the key to social and emotional learning. And primary schools are, if you like, the bedrock of social and emotional learning for children, for primary school children. It's their first move, if you like, away from home, beginning to sort of find out how they relate and how they operate within an external adult world. So how they deal with their emotions, how they manage social relationships, and how they manage and work with authority figures, teachers, is all key to learning, and it is an important bedrock for success in secondary schools.
Fabulous. Thank you ever so much, Chris. Really important points raised there. So we will now go to our second project, and I'm delighted to invite Bigfoot Arts Education and their interwoven community art project, which was to champion local identity and creative collaboration across generations. And it was in partnership with the Battle Hill Primary School as well as the library, and it was funded by the local authority. So Steph and Claire, over to yourselves. Thank you.
Oh, thank you. I'm just going to come with a precursor that I am in a staff room at the minute in a secondary school. I've come straight from a workshop, so hopefully it won't get much busier. But I'm really pleased to be here today. Thank you. I'm sorry that I joined a little bit later. Me and Claire haven't had much time to prepare together ahead of this this presentation, so I was thinking that I could maybe just speak a little bit from a Bigfoot perspective with regards to the successes that we saw relating to interwoven, and then if Claire would like to discuss a bit about the impact and any reflections from the young people that took part and the sessions which took place in Battle Hill when we were running the project. So interwoven, as an overview, thank you. Interwoven, it was a community art project. We predominantly used art as our art form to explore local identity in the Battle Hill area and to collaborate across generations. So although we worked in primary school and we worked with young people, we also worked with a range of other community groups who accessed the Battle Hill Library, and we enjoyed running sessions within school and within the library as well. It was really around understanding how people in the local community felt about their area and coming together to create a piece of artwork which they felt represented them and they felt really proud of. What we did was we explored under the section 106 funding. So we looked at the particular area in need of Battle Hill, and that's what we used as our evidence to discuss why we needed this project to run here. So what did we do? So we were, I'll talk from kind of what we did within the library, so Claire can talk about schools. Over the October half term, we ran sessions in the library, which were open to all walks of life, all generations, to come and work collaboratively on an art installation, which is still there in Battle Hill Library. And it was using cloth and using different materials, which created these beautiful spirals. And we worked with a Big Foot artist, Karen, to create that there. And what's beautiful, and I'm sure as you'll all appreciate, is the wonderful conversations that come out when you're busy with your hands. So there was loads of lovely conversations that we were having while we were making our artwork around feelings towards the community, what could be better, what is fantastic already, hearing local stories, people discovering the connections between one another that otherwise they maybe wouldn't have had if they were coming in the library on an ordinary day to just take out a book. We built a lovely relationship as well with the staff who were there. So the staff joined in, everyone had a chance to collaborate on the artwork. And what was really lovely is a lot of people were saying, oh, I haven't done anything like this in ages. I haven't just sat and made something. Especially kind of grandparents who brought their grandkids along during the half term. They really love making something together, and that bonding was a really wonderful outcome to see. They were talking about how they wanted to go away and make more work together. And they also saw a high increase of new people coming to the library who'd heard about the sessions and were looking for something to do over the October half term. So North Tyneside Libraries reported an increase of people using the service, which is really important because it can sometimes be a library which is underused, but it's such a community resource. And they loved to see as well the creatures that were created by the young people in Battle Hill Primary School, and the stories that were created as well. There we go. They were showcased in the library as well, which was wonderful. So the little knitted creatures you can see were created by a knit and natter group that get together in the Battle Hill Library. And the stories that the children had made in the workshops in Battle Hill School each had a character, and that was created by the Knit and Natter group. And as you can see, the chef hat spelled S-H-E-F. They kept everything like true to how the kids had created it, which was so gorgeous. And even those who experienced loneliness or isolation, some of the older members of the Knit and Natter group felt really connected to the children and really loved to kind of have that near but distant relationship, and see again through like a child's eyes, which was so precious to see. So it was really big impacts that we saw were around aspirations. So raising aspirations that anyone can do art. You don't have to be good at it. It's just something which is intrinsically good for us. It boosts our well-being. We saw an increase in service users coming to the library and then engaging with other events outside of the ones that we ran. We saw lovely intergenerational moments where children were asking their grandparents and their parents about creativity and about their lives and vice versa. And all around, it was just a real feel-good atmosphere that we built in those sessions that we delivered in the library, where we made something beautiful as a positive outcome. So I hope that's useful as an overview from our perspective. I'll hand over to Claire to talk a bit about the sessions that took place in school. Thank you.
Hello. So really it echoes a lot of what other people have said. For us, it was the project really created that sense of community. The children absolutely loved the drama and art sessions. It really got them creative. Those children that wouldn't necessarily feel like they could draw and that they could do, were super excited about the creations, and it made such a difference to them knowing that somebody might actually go and knit their character that they'd made. The children that did win were immensely proud, and couldn't actually believe that there was going to be somebody that was going to knit the pictures that they'd created. And we got a sense from the teachers. The teachers loved the sessions, and lots of the teachers came to me to say how much the children had enjoyed them. I think it was that sense of pride for the winners as well. And parents had commented that it got the children wanting to go to the library. All of the children were wanting to go to the library to show their parents what they'd done. The lovely book, because there was one winner that got theirs made, but all of the other artwork was produced into the books, so all of the children had something there in the library to show for it. So I think from a parent perspective and community perspective, it was really good to see that they wanted to go to the library and share that with parents. It also made us think a little bit more that actually we need to, I think after the pandemic, some of those relationships maybe broke down a little bit. We used to visit the library a lot more often than we have now, and we were going to the care home a lot and singing songs and having some of those art projects with them that maybe have broken down a little bit. And so we've, as staff, come together to look at how we can start those projects up again after seeing the success of this. That's everything, I think.
Fabulous. Wow, Steph and Claire, thank you so much. And I don't tire from seeing those lovely, I love seeing the ballerina one as well, and the different names. I know you've given a snapshot of them, but I think you've shared a fabulous example and articulated the many wide impacts that you got from your project. So hopefully when people are watching this back and they're thinking, oh, shall I put an application in? Oh, yeah, well, yes, we had that benefit. And then they need to think about how they might gather that and how they can evidence it and then share it. So I think you've given a real breadth of examples. And I love that, you know, it's true about the conversations while you're doing artwork and the different things that come out at that point that are really helpful. And wow, it's literacy by stealth as well, because it's having the pride in the, you know, creating a book gives that love of book that can only be a good thing for those literacy levels as well, but in a really enjoyable way. So fabulous. Do we have any questions or comments on that work, or any ideas?
I think the only thing I would add, Heather, is just that it's been lovely to see two projects which are quite diverse in nature, but really present creative arts as a low threat approach to supporting children's wellbeing. And I think that low threat, high engagement, high collegiality between pupils and parents and teachers and education and local authorities is a really nice way of promoting people's wellbeing overall, not just in the school setting, but outside of the school setting too. And I think, you know, when we're inviting parents in for those intergenerational and grandparents too, you know, for those intergenerational conversations or workshops, they really value that, particularly as an insight into what's happening during the child's day, or even as, you know, it's an opportunity for them to compare their child's skills to that of other children there too. So I think, you know, whilst we're looking at things from a creative health point of view, like you've just alluded to, the benefits are many fold, particularly literacy skills, numeracy skills, you know, personal development thereafter. So I think, you know, we're seeing things this morning from a very quick snapshot, but actually the benefits thereafter are much more significant. And probably we can't really put them into words. They're probably not as tangible as what we want them to be. But hopefully this morning's been provide a really good insight into how we might be able to capture some of that evaluation impact too.
Fabulous, thank you. And that's a nice little segue. I will copy and paste the quote that I highlighted at the beginning and the report that, well, the research that was commissioned by the Department of, I think it was Education, Culture and Sport. I'll put the link into the chat there as well. So Martin, you've got your hand up.
Yeah, and it's just a quick observation to build on top of Kate's response is that I think what's really great about hearing two different models, it shows how the areas you decide to explore are in your gift to decide how you go about those. There isn't a binary right and wrong answer here. You have to find your way through that using the people available to you. And I think what also comes through is that there's a very clear collaboration between Bigfoot and the school to come up with shared approaches and shared observations from the outset. And those two things are, it's in your gift to look at what you want to look at, but start as early and as soon as you can, and then you can track those through. Those are both free tools. They have no money, but they're actually just about the approach you have. I'd recommend that to all kind of people who want to look at that approach.
Huge value. Thank you, Martin. Unless there's any questions now, I think we can take them in the next question section, because I think it's a fab time to invite Mel Burgess to join us to share the details of the Chris Drinkwater Creative Health in Primary Schools Award. Thanks, Mel.
Thanks, Heather, and great to hear from those two projects this morning, and especially Bigfoot and Battle Hill, which were last year's winner of the Chris Drinkwater Creative Health in Primary Schools Awards. So I'm just here to tell you a bit about the awards and the criteria and how you apply, in the hope that this what you've heard so far this morning has whetted people's appetite into applying themselves. Oh, thank you. Carol's preempted my next slide, please, request. So just to give you a bit of background, really, these awards were launched in 2023, and Chris is here on the call and will be part of the panel discussion afterwards, but he had a previous role as Arts and Creativity Lead for the network, and when he stepped down from that role, and the awards were established to acknowledge his passion for creative health and his dedication to the network. I'm from North East Museums, and we've been working with the network since 2022 to fund the Arts Advisor role, which is currently filled by Martin, and to look at how we can increase that connectivity between the culture sector and the health sector, and how we can build that creative health world. So we're really proud to administer the Chris Drinkwater Awards in partnership with the network. And the purpose of the awards is to demonstrate the beneficial impact that the arts can have on the well-being of primary school children, and to showcase how bringing that creative expertise to the classroom especially benefits those in the highest areas of deprivation. So the aim with the awards is to grow interest and to share examples of creative health in primary schools right across the North East and North Cumbria, and ultimately that leads to better outcomes for the children involved and more opportunities to get involved in projects like we've heard from this morning. And there's a cash prize for winners and for runners-up, and that exists to enable ongoing creative health work and that ongoing partnership work, because we all know that budgets are stretched, and that with the best will in the world, we all want to be doing this work, but sometimes it's very difficult to find that money to be able to make these things happen. So first of all, just a little look at who can apply and who's eligible. So the awards focus on partnerships between primary schools and the arts and culture sector. So you can apply if you are a primary school that's been working with a cultural organisation or a freelance artist. And you can apply if you are a cultural organisation that's been working with a primary school. And we target this opportunity at schools that are serving communities where socioeconomic and health inequalities are most prevalent. So we do ask for the postcode of the school when you apply, so that we can have a little look at the community that you're serving and where you're based. And as you have gathered already from the rest of this session, we're most interested in the impact of the work. So it's the so what. We want to know what the outcomes have been of that partnership, and particularly in relation to improving health outcomes. So we're looking for applications that are focused on work that's recently been completed or that has been running long enough to be able to measure that impact. So if it's the early days of the project, then probably next year might be a better fit. But if you've got something where you've been able to gather that evidence so far, then this might be a good fit for you this year. Could I have the next slide, please? Great, so we've got a judging panel who look at all the award applications and score them against the criteria. So if you choose to submit an application, you would need to include evidence of these criteria. Please don't be scared by this incredibly long list of things that has just appeared on the screen, because it does look a little bit like, oh my goodness, how am I going to tick all these boxes? The first few are really simple yes/no statements that are just there to make sure that everyone's eligible. So the project needs to involve a primary school in the North East and North Cumbria geographic area, for example. The school needs to serve a population in an area with a high level of deprivation. It needs to be about promoting creative health benefits through the arts, and it needs to involve a primary school and a cultural organisation or an artist working in partnership. So those are really quick ones that, you know, before you start, you just know whether you are or are not those things. And then it's when we get into those more in-depth criteria where we want to see the evidence of that in your application and what that's looking like, so that we can kind of make those judgment calls. So I'll just go through them and give you a little bit more information about each one. So we're looking for projects that demonstrate an approach to address social and emotional learning to improve health and emotional outcomes. So has the project arisen from an identification of need amongst pupils? Have you identified a specific social and emotional gap and then designed the creative health project around that? So it's starting from that need and building a project around that. We've seen that in the projects demonstrated so far. It's that conversation you have in the beginning about where are we now and where do we want to get to. We have a criteria that's around inclusion of family support or involvement. And as Martin mentioned earlier, then if you want that longer term change to take place, then you need to have that family connection. So we're interested in how you've involved families in your work so that those changes are more holistic rather than just happening within school, but then not being followed up in the rest of children's lives. Evidence of feedback from pupils, teachers and families. So can you include the voices of participants in your application? So we want to know what the pupils themselves and the staff that are taking part and the families have found valuable and impactful and enjoyable. So we want to be able to see how you've been gathering that, and that might be through video, or it might be through surveys, or it might be through post-it notes or quick chats or whatever that might be. But something in there that shows us that you have been doing that and taking on board all of those different voices. And then evidence of the evaluation of impact of the initiative. So in addition to all of those feedback quotes and the data, then how do you know that it's been a good creative health project? So what have you measured? What's improved? How have you gone about that? And that really helps us build that evidence really right across the region of what the benefit of creative health work is. So it's not just your one project on its own, but actually collectively across all of our applications, how can we use that to build that evidence that this is a great approach to take and there really is real value in it for everybody. Where am I up to? So creative health benefits and outcomes highlighted in the application. So it's really important that your project is creative health focused. There's lots and lots of lovely arts and culture partnerships happening in primary schools, but what this particular award focuses on is creative health specifically. So those health benefits and outcomes do need to be central to the work to count for the awards. And we're also interested in an outline of how the work was funded. So we've had some examples in the past of some really innovative funding use, and it's just great to be able to share that best practice more widely and to give people ideas about where they could seek funding, how they could fund work like this, and how we can support people that are new to creative health projects to start thinking creatively about where the money might come from for those. And then the final criteria that we look at is that there's an opportunity for sustainability and spread of the project. So this is really thinking about those longer term opportunities. So after this project, what happens next? Could it be sustained over a longer period of time? Could it be replicated elsewhere? Could it be scaled up? What are those opportunities and how have you thought about those already? So that gives you a bit of an insight into the brains of the panel when we're looking at applications. So if you are putting in an application, then these are the kind of things that we want to hear about so that we can see how all of that has been working for you. And then if we can have the next slide, please, then we'll have a little look at how you apply. So the award is an annual process. So we've been open for applications for a while now, but we're getting closer now to that deadline. So we're in that kind of key bit where people are really thinking about putting in an application. So the closing date for submissions is Friday, the 7th of March. And all the information that you need to apply, including our guidance notes, is on our website, and the link is on the bottom of the slide there, and perhaps we can pop it in the chat as well, or I can put it in the chat after this. I can grab it from the website. And we accept applications in multiple formats because we want to make it as accessible and easy to apply as possible. So there is an online application form, which you can find on our website. That's an MS form that you fill in, answer the questions and then submit it to us. Or if you would like to have a look at a different format, then you can email your application to my colleague Claire Smith, who is here as well today. As I'm actually leaving North East Museums soon, so Claire is nobly picking up that baton to collect in applications. So you might want to submit a short PowerPoint that's no more than 5 slides long. You might want to submit an audio file or a video file that's no more than 5 minutes in length, or you might want to submit an A2 poster. But we've got a range of different options for applications, so you can pick what works best for you and your partnership. Our online application form guides you through all the criteria, but if you do want to submit in a different format, then please do bear in mind our list of criteria that we've just been through, and that we will be using those to judge applications. So we would ask that you use those to decide on what content you put in your submission. And we do have guidance notes on our website that lists those criteria as well, so you can use those as a checklist to make sure that you've got them all in there and you're evidencing what we need to see. And just finally, there's one more slide. If you are emailing us your submission, so if you are going down the PowerPoint route or the audio or the video or the poster, then to prevent you from using up your entire 5 minutes or whatever it is in just giving us the basic details about who you are and how we get in touch with you, then please can you put all of this information into your cover email so that you can concentrate on just telling us about the project itself in your submission. So we would ask you to just make sure that you've included the name of the person that's applying, their job title and email address, the name and postcode of the primary schools involved in the project, the contact name and email address for the school project lead if that's a different person, the name of the cultural organisation involved and their name and email address. So essentially, like, one of you will be submitting the application, but you've also worked with a partner, so can you just make sure everyone's details are included in that email, and then that gives us everything that we need. We're always happy to have further conversations if you want to apply. So if you want to apply, but you feel like you want to have a bit of a chat through it first, then you're more than welcome to. I'll pop my email address in the chat and I'm around until the 21st of February. You've got Claire's from the slide, and then you've also got the contact details for the network as well to be able to talk things through. But we really look forward to seeing more applications this year and hearing about more things that are going on. Thank you.
Fabulous. Thank you ever so much, Mel. Really, really comprehensive. And I love that emphasis on partnership at the end as well, because that really is, you know, that founding principle of the network as well, about coming together in partnership to enable more young people to thrive. So if there are any specific questions directly to Mel on that, but it was very thorough. If not, we will go straight to the panel. Now, as this isn't a usual live session and we're focusing on the recording to share with those people that can't join, then the panel questions for the panel is going to be slightly different. So first of all, just draw your attention to Mel's email address that she's popped in the chat there in case anyone's got any ideas and they want to talk through. Now we've got, I'm very proud of the panel we've got, and these are key colleagues that have been partners with the network and Museums North East since the inception of the awards, and bring something different each to them as panel members. So I wondered if we should go around the panel members and thanks, Steph, go around the panel members and just if they can introduce themselves. And also I wondered if, as part of this panel session, we ask them, I thought it would be intriguing to ask, what do you want to see more of in the awards? Because you've been around the circle a couple of times now, and what do you want to draw in? What are you most interested to see next time round? Because I think that might be quite helpful for people that are watching this recording and thinking about, oh, well, would that be of interest? And it might help them be inspired to progress their application. So if there's any other suggestions or any other comments that you want to highlight, panel members, do that. But otherwise, I will go through. If we start with Chris, and apologies for the typo on the slides there that I've just noticed. So Chris Drinkwater, delighted to ask you to come off mute and join us.
Thanks very much, Heather, and thank you, Mel, for that very comprehensive run through of the criteria for the awards. I think it made it very clear to everybody, and I hope we can encourage lots of people to apply. anything that raises the profile of the arts and creativity in primary schools, I think, is incredibly important. As we've already said, everybody is aware that schools are struggling with budgets, arts organisations are struggling with funding, libraries thinking about the Battle Hill project are also struggling. So it's not easy out there. But this is then impacting on the children and young people themselves. From a health perspective, we have some real problems around mental and emotional health of children and young people. You only need to look at the number of applications for assessment for neurodiversity and the referrals to child and adolescent mental health services. And sadly, the Northeast is a leader in this area in terms of demand for services. So this whole agenda around prevention is incredibly important. And finally, just picking up on sort of Heather's suggestion that we focus on what we would like to see. I think there's a sort of an issue, and perhaps the Battle Hill project exemplifies this in terms of how you make better use of all the local assets and how you engage with the local neighbourhood is incredibly important. So thinking about what's actually in your patch as a primary school, who's doing stuff in your patch, how do you engage with the library that serves your patch? How do you engage with the care homes and provide input to the care homes? Because care homes love seeing primary school kids. And so that whole agenda in terms of neighbourhood working, how you engage with your local neighbourhood, I think is of benefit both to the schools and the local community. And it'd be great to see sort of some more of that going on.
No, very much so. So important, especially for those communities, because they don't want to be travelling elsewhere. You absolutely want to get the benefit from your local community. Fabulous. Thank you ever so much, Chris. Mel, Martin has popped a really helpful question in the chat, and I wondered if you would like to respond to that one.
Yeah, and I think my answer to that question is also the same as what I'd like to see more of, really. I'd just like to see more people blowing their own trumpet, because I think that what always strikes me in my role, which is a regional one, and lots of partnership work and conversations with different schools and different cultural partners, is there's absolutely loads of amazing things going on out there, but they're not necessarily joined up, or they're not necessarily aware of one another. And I think with something like creative health, which is, you know, a kind of relatively new term in the grand scheme of things, is that I think it can be easy to think, oh yes, well, I'm doing that, but am I doing it well enough to put myself forward for an award? And the answer to that is yes. Like, you know, if you are thinking about this work at this point, then yes, you absolutely should be putting yourself forward for an award. And what that helps us to do, and, you know, helps the network to do more generally, is there's more power in being able to hold up all of those projects as a vast diversity of ways of engaging with creative health than individuals going, oh, look, I'm doing this thing over here and I'm doing this over here. It just helps build that bigger picture, and for us to be able to say, look at everything that is happening across the region and look at the collective impact of that work right across the board. So I think that's really helpful for us to make things more visible and to use the connections that we have to talk about things as a whole. And to make those connections between different projects as well, so that we can all learn from one another.
Lovely, thank you. And a really important message you raise about creative health. And we have had questions about, should we call it something different, because it was seen as a potential barrier, and that might be something that Kate might want to come in on as well. And because from a school's perspective, we kept creative health because nationally that's the terminology that's being used as well, and we wanted to be in line with that and the framework and resources that are associated with it. So Kate, without further ado, I'll pass over to you before we close with Carol.
I think it's really interesting, isn't it, looking at things from a health perspective, a local authorities perspective, NHS perspective, educational perspective, and then trying to work out how all of this fits into creative health. I think so much of what we do does fit under that umbrella term of creative health. And when you go to Arts Council and you look at the definition of culture now and how that's changed, and the definition of creativity and how that's changed, the things that we do at primary school level all typically fit in under that umbrella term of culture, creativity, and creative health. And then if we, position ourselves into the Ofsted framework and what it says about personal development, I'll just read from it here. It says, personal development should develop pupils' characters, which we define as a set of positive personal traits, dispositions, and virtues. And so this gives pupils the qualities that they need to flourish in our society. And I think if we think about how they're flourishing in our society, creative health can do so much of that. Also, later on it says, we develop people's confidence, resilience, and knowledge so that they can keep themselves mentally healthy. And actually, if you think about the project that you can have under that umbrella term, creative health, we can keep our pupils mentally healthy. And I think it goes on to talk about pupils being active citizens in their communities. And, when we're referencing care homes, we're referencing going to the library. We do so much of that anyway. It's probably just about putting it together in an award format so that you can really recognise how you had an impact on the pupils' lives and your wider community. I think about some of the work we're doing here in Berkeley. We've got the Nourish Food School coming in to work with us and have individual food workshops with year groups and parents together in that very low threat approach, so that parents and children get to understand the fundamental skill of cooking. That's hopefully going to help them thrive as they get older, keep them nutritionally well, keep them mentally well, and keep them healthy. And actually, if we think about that, that's under the term of creative health. So I think it's about taking stock, reflecting on what we do, and think, actually, how is this going to help our children flourish in the years to come? And I think without any doubt, what you'll be doing in primary school will be able to be positioned under that term. It'll just be about recording the impact. And I think, as we've alluded to there, it's about how we recognise the impact ourselves and then sell it to our communities. And I think, some of the things I've seen, say, for instance, on social media and Facebook, where, schools are sending out admissions policies saying, by the way, come to our school. And they're saying, we've got the top results in whichever local authority. Are we sending out the things that we are really good at? For instance, or are we saying these are the groups that we're in partnership with? This is what we do to help our children flourish. So I think there's definitely more that we can do to sell what we're doing in primary schools to help, the child get a real good sense of personal development as they progress our primary school education.
Fabulous. And I'm really hearing from all of those comments that there are lots of innovations out there that they won't even think are innovations. There's just great normal work that is relevant to the arts and benefit the young people within those primary schools. And it would be great to have them all applying to our Chris Drinkwater Creative Health Awards this time. So thank you ever so much. Wendy Kelly unfortunately isn't with us today, but she is a fabulous contributor to our panel discussions as well. So without further ado, thank you ever so much to all our panel members and our presenters. But before we sign off, it's really important that we just look on the horizon, and I will be putting in a link that people can join the network if they're not already members. And Carol's just going to give you a flavour on what's on offer in the coming weeks and months. Thank you, Carol.
Thank you, Heather. Good afternoon, I'm Carol Wilkinson. I'm a Project Support Officer for the network, and I'm just going to use a couple of minutes of your time just to highlight what resources that we have on offer. So our first one and predominant one is the Healthier Together resource. It's a website and app. This is aimed at parents, professionals, obviously carers. It's a means by which parents and carers can look at symptoms being experienced when children are poorly, and it can guide to the appropriate course of action. It's a two-prong approach. It's used to reduce parental anxiety and also pressures on services where it can. This is available to download via Google Play or the App Store. Within the website, there is also a professional section, which is where links can be shared. There's resources. It's useful information for professionals to use. So obviously, if you're not signed up or download the app, the QR codes to be able to do that. The next slide is around communicating and engaging with the network. From our perspective, we really like it when you engage with us. If this is the first event that you've attended, you can become a member. The QR code is in the chat, and there is obviously links to join the network via receiving our Child Health Tuesday bulletin. We put in all of our events and future upcoming links, opportunities and resources within there. Our next event is next week, and that's on fetal alcohol spectrum disorder. So again, if you join to become a member, you will receive all of those links and how to join those events. Moving on, there's a summary of links and opportunities that you can follow. Again, these will be received in the slides, and again, it's very easy how to become involved and how to join what we're doing here at the network. Thank you.
Fabulous. Thank you ever so much for giving that flavour to everyone. There are our contacts and our new LinkedIn page, as well as we use Twitter and X less and less. Thank you so much for your time. If you're contemplating whether to apply, I hope this has helped clarify that decision-making process for you, and will help us unite together to create a great sort of swell of interest and enthusiasm for creative health for the young people within our region. Thanks ever so much, everybody.
Thank you.